Today, we're going to talk about managing your wound and scar after a hip or knee replacement. My name is Dr. Anthony Murray, and I am a hip and knee replacement specialist from Town & Country Orthopaedics. To get through to the joint to replace it, either your hip or your knee, you guess it, we have to cut through the skin. An anterior approach hip replacement has a small skin incision, approximately 5 to 8 centimetres long, over the front of your thigh. Your minimally invasive knee replacement is through an incision over your knee. As much as replacing the joint is our mechanical goal, the tissue that envelops the joint is critical in our surgery, repair and care. In fact, I tell most patients these are as much a soft tissue operation as a joint replacing operation. Because an anterior approach hip replacement doesn't detach any muscles from the bone or cut any tendons, you won't require any repairs of muscles or tendons, and we allow the muscles to flow back onto each other as they did before we went between them. For the skin, I use only dissolving stitches inside the wound, so you won't require anything to be removed later, such as staples or stitches. These typically break down over time and are reabsorbed by the body. The new generation of stitches I use also contain triclosan, which has been shown to reduce the risk of infection around the surgical site. A special wound dressing of a fine mesh and antibacterial glue is placed over the top of the wound to further improve the healing, and a waterproof dressing is placed over this. This allows you to shower and to move freely with your wound covered while it is healing for the first 2 weeks. This dressing stays on for the full 2 weeks and should not be changed unless there is an issue where it falls off or is damaged, in which case it is replaced with a new dressing. Don't be worried if the edges fray or lift off a little, but if the dressing begins to peel off or not be watertight, we would like it to be changed. We place the dressings on in the sterile environment of theatre and like those to remain until the wound has healed up and we're ready to start the scar treatment. When we remove the dressing and inspect the wound, we just like to ensure that the wound edges have healed together, there are no open areas that haven't closed or unusually haven't healed, and that it looks neat and uniform. A small amount of people can generate a response to the stitch material where their body treats it like a foreign body and they form a small stitch abscess. These are generally not problematic, but will be closely monitored until they are healed. Once the wound has healed and is watertight, there can be small scabs or dry skin or glue around the edges and over the wound. We like to encourage scar massage with a product like bio oil or vitamin E creams to encourage scar breakdown and healing. These have been proven to reduce scar sensitivity and size, and I recommend all people to have a twice daily routine of applying these to their hip or knee wounds. If there are issues with the wound healing or stubborn areas that take longer than normal, we pay close attention to them right up until they are healed. As always, I hope you've learned a little. Please leave a like and subscribe to this channel to receive more educational videos on hip and knee replacements.